Hey, it worked. Good job. Thank you.
Yeah, I'm glad.
We'll see if anybody shows up today. Do we have, Rukia, do you have to let people in, or can they, will they just auto join when they click on the link?
They should be able to just join right away.
Okay.
We did create a new listserv though that Victoria sent me. Do you know if everyone was added to it?
I have no clue. Maybe the next week we can just cross-reference. But we'll wait 1 minute. If not, then I'll just go through the slides and then we can record it and upload it. Okay, Rukia, if you can just share the slides, I'll quickly go through the presentation.
Okay, sounds good.
Thanks. Okay. Good afternoon, everybody. Thanks for joining us for our monthly HiPAM community work group. As always, starting off with the international overview. Japan obviously continues to decrease and holding constant with that decreasing trend with their COVID cases and their hospitalizations. Next slide. Korea, from their last peak, returning back to what appears to be a normal steady state for them. It remains to be seen if they're going to return to levels from May and June of earlier this year. But good news is they're trending down. Next slide. India, no major threats to them, so that's good. But always here because they're the originators of the Delta variant. Next slide. From a national perspective, our country continues to trend in the right direction. Obviously, we still have some hotspots in certain localities. Alaska is still recovering, and then you have certain zip codes across certain states that are still struggling. But as a whole, our country is on the right path. Next slide. Arizona, California looks to be heading in the right direction. It's still too early to see, but I think the good news is vaccinations continue to increase, and natural immunity is probably wider spread than we think. Next slide. And then Nevada and Texas also mirroring the national trend of a decreasing trend. Next slide. In terms of the state overview, majority of the counties are near the 3% threshold. Maui has crossed that and is now under 3% for their percent positivity. But overall trending in the right direction and looking good. Though we're still keeping an eye out on certain locations within the state for hospital capacity. Next slide. Vaccination wise, continuing to do well. It's hard to get a true perspective, but I think it's safe to say that over 70% of our population has at least one vaccine. which one dose of the vaccine. And we expect that the FDA will grant EUA, or at least hear the data from Pfizer for 5211s in a week or so. So hopefully that should drastically open up the population for our state for eligible populations. Next slide. Our forecast, as you can see, it looks a little different, but I think it adds more clarity to our trends, and also what the real data, so you can kind of see where we are, and where we were, and where we projected to be, and the accuracy of our numbers. But as you can see, no, we're not really showing any major increases, continuing that decreasing trend we're seeing nationally. That red, that pessimistic model, still nothing major to be concerned about. But we're still keeping an eye out, especially as we get into the holiday season and potentially increased travel and loosening of restrictions. So still not quite the time to declare overall victory and move forward. Next slide. And then this slide is just what you're seeing on the previous slide, just numerical format. Next slide, please. Finally, a lot of major highlights, a couple of them. A major one today that obviously didn't make it into my update last night. So I'll start with that first. So the FDA panel unanimously recommended a booster for Moderna vaccine, notably half the dosage, for 65 and older, at-risk populations, and 18 to 64 if they work in an environment with increased contact with potential transmission. So that's big news, waiting for FDA to adopt that, and then for CDC to make their recommendation to be in line with the FDA. So that's big news on the booster front. And then you can see the four that we're going to talk about: CDC recommendations for boosters for Pfizer, and then what we currently know about antibody levels and immunity and vaccines, and then the third one has to do with the situation on the state, and then the fourth one is really exciting and has huge potential ramifications for the world. Next slide. Oh, I apologize. I did not put the slide for the first one, but basically the highlight is the CDC will be, Rukia, if you can go back to the previous slide, please. So CDC recommends boosters for certain demographics for the Pfizer vaccine, and we're expecting, like I said previously, an update for Pfizer for the 5 to 11-year-olds. Next slide. Oh, if you can go back one. Perfect. So, a lot has been made in the past 2 to 3 weeks about, decreasing antibody levels and the need for boosters. And that's important because I think people not truly understanding the immunology and how complex the immune system is. And I think that's the one of the quotes that I had about antibodies. So antibodies is just one method of measuring immunity, but it's not the only method. And what we're learning about long-term immunity is antibody levels is not the best way to look at and to measure long-term immunity against COVID. And that's based on previous knowledge from other diseases. So, I put 3 quotes from this Reuters article, which does a good job of really simplifying, but from experts, important facts for this particular topic. So, the second one, immunity is not something we can just wrap up in measuring an antibody or T cell response. Immunity is about the system working together. So next time you come across the infection, you won't get it at all or won't get seriously ill. That's protective immunity. And then importantly, antibody responses are usually short-lived. And that has less to do with long-term immunity. So there's the next few slides. Next slide, please, Rukia. I wanted to add so that people could really truly understand, you're going to have people say, well, natural immunity, let's just get COVID. So this kind of really breaks down for us, the pros and cons of just getting COVID and, getting natural immunity versus getting vaccine acquired immunity. And I see that Dr. Berryman and Jim are our attendees today, but this is recorded, so want to go through these slides. Vaccination is a safe and controlled method of inducing an immune response versus if you just take your chances with COVID, it's much more difficult to control that, and also you're not going to spread COVID with any one of the FDA, EUA, or fully approved vaccines, but you can spread COVID if you get COVID. Next slide. The immune response from natural infection will vary greatly, based on a whole host of factors, and it has been linked with disease severity. So if you have the disease longer, you're probably going to have a stronger immune response, but there's no way to control that. Versus if you have vaccine acquired immunity, more uniformly will experience a more robust immune response. Next slide. And then length of protection. We're still learning from the vaccine perspective, but 8, 9, 10 months out, we're still, in terms of the most important thing, which is keeping people out of the hospital and dying, it is still hugely successful in vaccine efficacy. Versus natural infection, it does reduce over time. Let me check the Q&A. So a question from Jim. We know vaccinated persons can be asymptomatic but still carry and transmit the virus. So that's true, Jim. But what we're also seeing is that just because there has been some studies showing that the viral load is the same for vaccinated, unvaccinated, what we're learning from the virologists is that the amount of infectious virus in a vaccinated person is much lower than those in an unvaccinated. So just because the viral loads are the same doesn't necessarily mean that they're just as likely to transmit the disease. And we see that in real world situations where the case rate in vaccinated populations is much lower than in unvaccinated. So testing is still important for sure. But we have to make sure we truly understand the impacts of the testing results based on the population that we're testing. But thanks for that. And I'm glad I could clarify that point. Next slide, Rukio. And then the variants, right? So, especially for the mRNA vaccines, yes, you have decreasing vaccine efficacy against infection against the variants. However, it's still highly protective and effective against hospitalization for, even with the Delta variant versus natural infection. Immune system may not be able to recognize a viral variant. And then with the mRNA, that technology allows us to quickly pivot to an emerging serious strain. So that's another benefit. Next slide. And then these are all of the recommendations by the CDC for the booster for the Pfizer vaccine. I'm not going to read it off, but interesting that they stopped short of saying anybody 18 or can get it. I think there's been a lot in the news about experts within the federal community, federal scientific community, really strongly believing about vaccine equity, and which is in line with the WHO chief saying, boosters is immoral and unethical at this time. So until we get more of the world fully vaccinated, and from my global health perspective, I completely agree. Unless, once again, you fit these certain points, if you're at risk, immunocompromised, et cetera, then obviously, yes, we need to continue to protect you from severe illness. But if you're a healthy individual with two doses of a mRNA vaccine, the science at this point does not show that you need a booster. Next slide. And then, a little closer to home, Civil Bee did an article on some experts in terms of they are highly visible in the community, and basically saying, we need to move, learn to live with it. And they talk about social determinants of health. Next slide, please, Rukia. And completely agree, this is a much more complex issue than just looking at COVID cases. I think any public health professional and those who became very interested in public health in the past year will be able to tell right off the bat that there are so many health inequities that were associated and are associated with COVID cases and hospitalizations. So, hopefully we can learn a lot of lessons and really invest more in public health. What's important to note is the landscape today is much different than last year, April of 2020, where we didn't know anything. We didn't have any treatments or preventative, mainly the vaccine. And therefore we had to use more drastic mitigation efforts. And now we have the ability to be a lot more targeted with how we reopen. Next slide. And then finally, this is really exciting news, I think, from both a clinical standpoint and a public health standpoint in terms of this molnupiravir, once EUA, granted EUA by the FDA, is a big tool in the toolkit in terms of preventing further severe disease progression, regardless if you're in the vaccinated or unvaccinated population. Obviously, and also prevention is still worth the pound of cure. So vaccinations are still the best method of preventing disease. But in the event, and we have to realize that we're going to continue to deal with COVID, hopefully just not on the scale that we did in the past year and a half. This is like the COVID version of Tamiflu, and really given early and effectively, we can truly support our healthcare facilities and our healthcare providers from truly dealing with the severe cases. And the good thing is, compared to remdesivir, this is a pill form, so it's much easier to administer and widely disseminate. And I believe that is the last slide, Rukia, if you can just verify.
Yes, that's all.
Awesome. So any questions from Dr. Berryman or Jim before we close up for the day? Thank you guys for showing up. I know that, COVID fatigue has hit everybody, but appreciate your continued participation. Okay. Thank you guys for attending, and I think what will be interesting is how we move forward from a policy perspective and how we can truly start to learn from these lessons. And just like Taiwan and South Korea and Japan have learned from SARS and MERS and revised policy to be able to react faster, I'm curious as a private citizen, as a public health professional, to see where we're going to move forward as a state and also as a country. So we'll still have lots to discuss, just not from a day-to-day perspective of COVID, but more from a long-term strategic perspective. So have a great weekend, everybody, and we will see you. Oh, wait. Oh, you're very welcome, Jim. Thanks for coming. And we'll see you guys next month. Take care, everybody. Thank you, Rukia. Thank you all.